Did you know that 1 in 3 Americans will be diagnosed with cancer at some point in their lives? But here's the alarming truth. Every year, millions of these cases are detected too late, simply because early warning signs were missed or dismissed. According to the American Cancer Society, if cancer is caught in its earliest stages, the chances of successful treatment can be as high as 90% or more. But if diagnosis is delayed until the disease has progressed, survival rates can drop below 20%. In the next few minutes, I'll walk you through 8 subtle warning signs that your body might be giving you. Signs that are easy to overlook, but could literally save your life if caught in time. These aren't your typical symptoms that everyone talks about. These are silent signals, supported by medical research, that many people have used to detect cancer early, when treatment is most effective. Now I get it. These days, it seems like every little ache or wave of fatigue we feel ends up being linked to cancer in some article online. But don't worry, this video isn't about stirring up panic. We're focusing only on scientifically backed symptoms confirmed by medical professionals, not internet myths or clickbait scare tactics. So let's get started. Persistent bone pain. One frequently overlooked symptom of cancer is unexplained. Persistent bone pain. This isn't the kind of soreness you get from a tough workout or bumping into the coffee table. The pain caused by bone cancer, or by cancer that has metastasized, spread, to the bones, tends to get worse over time, especially at night. This type of pain is often deep, aching, and doesn't go away with rest or over-the-counter painkillers. One of the most common types is osteosarcoma, which usually affects long bones like the femur, thigh, humerus, upper arm, or tibia, shin. At first, it may feel like a minor sprain or muscle strain, but eventually, the pain becomes constant and impossible to ignore. Some patients describe it as a deep gnawing ache that wakes them up at night. Other warning signs can include swelling, tenderness, or even spontaneous fractures without significant trauma. If you're experiencing any of these symptoms, especially if they're getting worse, don't brush them off. Getting evaluated early can make a life-saving difference. Eye pain or vision. Changes. Your eyes aren't just windows to your soul. They can also reveal important clues about your health. In rare cases, they may signal an early warning of ocular melanoma, the most common type of eye cancer in adults. The symptoms are often subtle and easily mistaken for typical vision issues. Watch out for blurred vision that doesn't improve, with new glasses, flashes of light, a dark spot on the iris, the colored part of your eye, that changes size or color over time. People with fair skin or light-colored eyes are at higher risk, especially with long-term sun exposure. Modern tools like digital retinal imaging can detect these signs before you even notice them. If you experience ongoing eye pain or unexplained vision changes, it's time to schedule a comprehensive eye exam. Catching ocular melanoma early could not only save your sight, but your life. Unusual skin rashes or spots. Not all rashes are harmless. Some may look like a mild irritation, but can actually be symptoms of a serious underlying condition, such as leukemia, a cancer of the blood forming tissues. Leukemia can lead to petechiae, small, round, pinpoint spots on the skin that may appear red, purple, or brown. These occur when platelet levels are low, and tiny blood vessels, capillaries, leak blood under the skin. These spots typically show up in areas under pressure, like around the ankles or under tight waistbands, and don't fade when pressed. Unlike common rashes that itch or go away on their own, petechiae tend to linger and may be accompanied by other symptoms like easy bruising, unexplained bleeding, extreme fatigue. If you notice these skin changes, especially in combination, don't ignore them. Your body may be trying to warn you about something serious. A dark stripe under the nail. Here's a lesser-known but dangerous sign. A dark vertical stripe under your fingernail or toenail. This could be a symptom of subungual melanoma, a rare but aggressive skin cancer that forms beneath the nail. It usually begins as a thin, dark band running along the length of the nail, called melanonychia striata in medical terms. Here's what makes it different from normal nail pigmentation. It appears suddenly. It may grow wider over time. It can have uneven color or blurry edges. This type of cancer most often affects the thumb or big toe, but it can develop under any nail. Unfortunately, many people mistake it for a bruise, fungal infection, or simple injury and delay getting it checked. Warning signs include: the stripe is wider than 3 millimeters. The color spreads to the surrounding skin, a sign called Hutchinson's sign. Nail splitting, pain, or bleeding. If you notice these changes, see a dermatologist immediately. Early diagnosis is critical for successful treatment of this fast-spreading cancer. Night sweats, without a clear cause, waking up drenched in how? Sweat even when the room is cool? This could be more than just a warm night. Unexplained, persistent night sweats may be an early indicator of lymphoma, a cancer of the lymphatic system. It's important to distinguish these from night sweats caused by common triggers like anxiety or menopause. Lymphoma-related night sweats often come with fever, unexplained weight loss, chronic fatigue. Why does this happen? Cancer cells can trigger an immune response, causing the body to release inflammatory chemicals that mess with your temperature regulation. If you're waking up soaked night after night, like you just ran a marathon in your sleep, this is not normal. It's a red flag that requires medical attention. Persistent acid reflux that won't go away. We've all had heartburn from time to time. But chronic acid reflux, especially if it doesn't improve with lifestyle changes or over-the-counter meds, could be a warning sign of esophageal cancer. This isn't your average case of indigestion. Cancer-related heartburn tends to resist treatment, and the repeated acid exposure can eventually cause a precancerous condition called Barrett's esophagus, where the lining of the esophagus begins to change. Warning signs include difficulty swallowing food, getting stuck in your throat, unexplained weight loss. If you've been relying on antacids for more than 3 weeks and still have symptoms, don't wait. Talk to a gastroenterologist. Early detection could prevent a very serious diagnosis later on. Yellowing skin or eyes. If you suddenly notice a yellow tint to your skin or the whites of your eyes, that's called jaundice, and it's not something to brush off. Jaundice occurs when a pigment called bilirubin builds up in the blood. This can be caused by various liver issues, but in adults, sudden jaundice may be an early sign of pancreatic or liver cancer. Pancreatic tumors can block the bile duct, preventing bile from draining properly, which causes it to leak into the bloodstream. This results in the skin and eyes taking on a yellow hue. Other symptoms that may appear: pain in the upper abdomen, dark urine, pale or gray-colored stools. Since the pancreas is buried deep within your abdomen, early symptoms are hard to detect, but jaundice is a visible warning sign, and one you shouldn't ignore. Persistent, unexplained fever. If you've been dealing with a low-grade fever for weeks, or experience recurring fevers without any clear cause, your body could be fighting more than just a passing bug. Blood cancers like leukemia or lymphoma often cause persistent fevers that don't respond to normal treatment. These aren't like fevers from a cold or flu that break after a few days. Cancer-related fevers are cyclical, can be low-grade, 100.4 degrees or higher, are usually accompanied by fatigue, night sweats, and weight loss. This happens because your immune system is responding to the cancer, releasing chemicals called cytokines that raise your body temperature. If your fever persists for more than 2 weeks with no clear cause, it's time to see your doctor. Simple blood tests could reveal early signs of a serious illness. And while not all fevers point to cancer, ignoring the warning signs could cost you. Thanks for watching.